Okay, we're going to go ahead and start with uh, this particular lecture on children's drawings and artwork. Um, Let me share my screen and pretty sure that's the one. There we go. Okay, analyzing children's drawings, and this is incorrect here. I actually have a doctorate. And I couldn't remember in class Carl Jung's name for some reason, but according to Carl Jung's theory, it's thought that drawings either compensate or complement the psyche. So in other words, that means if they're either in contrast to what a child is thinking, or they complement what the child is thinking. They are authentic, or they are make believe, in other words. And when you have an overly passive child who does not show any anger or protest, and then you give them paper and pencil and they draw vigorously, they are trying to purge some of their innermost thoughts, whatever is going on in their subconscious, and it's coming out in their artwork on paper. And that's how you restore the balance. Okay. So some of the things that we look for in children's drawings, what does the picture actually convey? What might be odd or missing? Are there missing limbs from a person that has been drawn? What is central in the picture? Are there any barriers? Like, are there windows? Are there doors? Are there the sides of walls? Is there any underlining, or is there any sky? Things like that. Any size or shape distortion? Repeated objects? When you have repeated objects in a picture, then the child is really trying to get that point across, that this is something that they're really thinking about, they're fearful of, or that is really predominating their mind at the time. Any shading or edging or underlining? The use of the paper. Do they use the whole piece of paper or just one tiny little section? Are there seasons or age depicted in the picture? Erasure marks, have they tried really hard to get that point across, and they have used a pencil and then they've erased it and then they've used the pencil again over it, making the paper somewhat delicate, and then it can accordion or rip. Words. When children are not confident about their artistic ability, they often will put words in their picture to make sure that you understand what they're drawing. Any movement in the picture, or trees. The use of color, because as I've shared previously, color has a lot of symbolic meaning. So what you don't see in this picture, unfortunately, this is the hospital that this little patient drew, and he is a hematology oncology patient. He's lost some of his hair from his chemotherapy, and he has a bandana covering his head, his little bald head. He has a friend outside with him. There's grass here, so there's a boundary there. These are some flowers. And there is a front door for the hospital and windows, so you can go in and come out and things like that. There are clouds in the sky. There's a sunshine, and that's very hopeful. And then a tree, and trees symbolize support, strength, protection, things like that. So this is a very grounded and happy child. And this all comes out in his picture. In fact, he's got a smile on his face. This is a young patient who draws, you don't really see her face or hair, but she's got kind of a solemn look on her face, a grimace, or no expression at all. And she doesn't have any arms or legs in this picture. This is her dress. It's got a rainbow, which symbolically means that there's some hope. She often has dressing changes, which means a tegaderm bandage on her port, and the tegaderm sticks to the skin, and it's really painful to peel that tegaderm bandage off. She doesn't get a lot of emotional support from her mom or her grandmother, and she needs to be held down during these dressing changes. So she draws herself with no arms because they are of no use to her. This is a picture of a patient, Vivian, and this is Vivian here, and she has an apple on her tray table. And this is her little roommate in the hospital who also has an apple on the table. These school-age kiddos really cope best with hospitalization because they're used to being away for long periods of the day in school, and they rely on socializing with their peers. It is very important that kids in the hospital have continuation of school, so they both have apples on their tray tables because they look forward to seeing the hospital school teacher. And this is Vivian. She's age 9, and you don't see the VIVI, and then you see the AN. This is a young prodigal artist or child. I do think that the age where it says age 3 is probably a mistake. This could be an older child because usually 3-year-olds, like I mentioned with Victor Lowenfeld's artistic ability, children don't write or draw with this much detail. And what you don't see is the little bandana on his head to cover his bald head. And this young child draws with so much detail in the same way that it is explained to him that when you have cancer or blood disorder, your ammunition or your good soldiers to fight the bad disease in your body, you need that IV and the solution that goes into your IV into your arm and floods your body with all of those good soldiers. So this is exactly the way the nursing specialist will describe what chemotherapy does in the body. And for this child to understand it enough to draw all of that detail leads me to believe that age 3 is a mistake. Or this is your next Michelangelo. I mean, this is just way too much detail for a 3-year-old. This is Lauren Moreno. There's an O on the end here. She's 7.5. Don't forget the half. She's admitted for diabetes, and she draws her bed here. I guess they're just one side has wheels, a window. So the hospital isn't a place where you go and you're locked in. I mean, there are windows and so forth. This is her nurse, and the nurse is giving her insulin, an injection, and she writes bad. And then she also draws her little insulin pump that she's transitioning to, so she doesn't need injections anymore, and she writes good for the insulin pump. And then it's also good because it will help to regulate her her insulin levels so that she can eat things like ice creams, and she writes good here. So again, this is a lot of labeling because perhaps she doesn't think she draws very well. This is Madison Jacobson. She's age 9, and it is the progression of her stay. It's a little unusual here because she changes the color of her hair. So this is her nurse, this is her doctor, and at first she is bedbound. So she draws a picture of herself in bed with nice warm blankets. Perhaps the pillow's an afterthought, or she's got her head under the pillow. I'm not sure. Then she's able to come to the playroom with in a wheelchair. So this is her wheelchair, and she changes the color of her hair. And then I want you to see the disproportionate drawing of a syringe, because kids really focus in on the things that are not so great. So, and they will draw them larger than life. And then this is a picture of Madison when she's able to ambulate to the playroom, which means she can walk to the playroom with her IV pole. And again, her hair color, pardon me, has changed back to blonde. And then I think I might have talked about this in class, but this is a young patient admitted to the hematology oncology department. And he has low blood counts, which means that he's got some sort of infection brewing. And so that means he doesn't have enough blood cells, good blood cells to fight off the infection. So he stays in isolation, and he's unable to go to the playroom. He doesn't look very happy. That's not a happy look on his face. His arms are really large, interesting. And then he draws his room with no windows, no door, so there's no way out, which is a clue that he feels trapped. And this is the playroom. This is the motivated behavior here. He wants to be in the playroom, and I think Rose's arms are really long as well. But there's no door on the playroom as well. And it looks like he draws his room as far away from the playroom as possible, when in actuality, his room was right next to the playroom. So in his mind, there's this huge gap between going to the playroom or the playroom and his ability to do so, because no door, he's in isolation, so he draws his room as far away as possible. And it's really unfortunate that a lot of the detail didn't come out. You see 4 nurses here. This is a teenager who has a diagnosis of black fan diamond syndrome. And so she comes in every 28 days for blood transfusions. And so what you don't see is these are her 4 favorite nurses. She will sit at the nursing desk and kind of want things to do, and so they give her papers to staple or what have you. And so here she draws a curtain, and she draws herself sitting in bed, and there's a bookcase over here, a television set, and she's got a calendar, and there's an X on the 28th day because she comes in every 28 days. And then there's also a tray table with a can of soda, and it says cola on it, and it says good. And then there's a tray of food, and she writes yuck. So it's unfortunate that you don't see all of that, but it's kind of like a 2-part piece of Crystal in her room and then her 4 favorite nurses. And she would sit at the desk at shift change and say, "Oh, do you have me tonight, Emmy? Please put your name next to mine on the dry erase board." So she would kind of ask which nurse that, can I have you tonight, for preferences, because they all seem to be her pals, and she developed relationships with the nurses over time. So those are some of the art therapy pictures that I wanted to share with you. Let me go back here and show you that Victor Lowenfeld's art development skills in children. Oh, sorry, need to click on that. And I'm not sure what happened to my voice. Come on, open up. There we go. So it starts with a very young age, and they do scribbles, random kind of lines and scribbles and so forth. And then the scribbles become a bit more precise. This looks like a lollipop. And then this is pre-schematic where they add a little bit more detail. And this is that 4 to 7 years of age. So oh, well, it says symbolism starts between 4 and 5. And so that's the symbolism that they put into their little cephalopods. Little more symbolism here. There's some ears there. Look at these tiny little feet. And there's hair, and I don't know if that's an ear or an earring or what, but so there's a little more detail. And then this is some of the symbolism that is seen at that age, and then human figures, and then the schematic stage is when children are between 7 and 9, and they add a lot more detail. So pre-schematic is cephalopods with details, and that is, there's a question on the final about that pre-schematic stage. And I'm not going to go through all of this. It's very interesting, but you can view all of that on your own. And then I wanted to just go over the difference between therapeutic play and play therapy. They are not the same thing, and there are a lot of slides in this slide set, but I want you to know that if you were asked on the final exam if therapeutic play and play therapy are the same thing, and they are not. Therapeutic play is generally what we are able to do in the hospital. It's short term. Where play therapy is more long term. Play therapy is a minimum of 23 weeks of appointments, and those are for more um, just more conflicts within development, abuse, and witnessing violence, or witnessing a traumatic event, a fire, an earthquake, an airplane crash, things like that. Children who have been abused in any shape or form need to work through all of those feelings, and feelings of powerlessness, and having no control. And so those are the deep-seated issues that play therapy addresses. So you need a longer period of time. They are one-to-one. In other words, a therapist in the room with the young child and no one else. And therapeutic play, we don't typically have the luxury of that one-to-one. We tend to be the only discipline that works with groups of children in healthcare. And we do use some of the play therapy techniques, but they're adapted to the situation and the supplies that we have. Where play therapy requires certain types of toys, where every play therapy room will have the same kind of toys: a baby doll, a toy gun, a ball, a bottle, a bop it, which is like this blow up clown thing that has a sand bottom and weighted, so that when you hit it, it goes back and pops up again. So in our therapeutic playrooms, activity rooms, we have whatever the community donates to us, because we typically don't have a budget to order things from. We do get wonderful donations of toys. a lot of very wonderful developmental toys, but we also get Barbie dolls and Hot Wheel cars and things that you may not see in a play therapy room. Our training and background is different from play therapists who have master's degrees and 2,000 hours of supervised play therapy um, uh, clinical experience. Whereas child life specialists, we have bachelor's and master's and doctorates, but we have about 750 hours of supervised clinical experience. We take a certification exam, which is internationally recognized, whereas play therapists are certified in a different fashion. So they're two different disciplines and they are not the same thing. And that's really the take-home message here. They are two very different things. However, in play therapy, they use sand tray experiences, they use puppets, they use filial therapy, which is family therapy, where they would see the child and then they would see the parent, and kind of try to make a connection between the child and parent and get them on the same wavelength in terms of getting the child through their fears and phobias and disorders. So these are some of the things that play therapy might address: hopelessness, withdrawal, oppositional defiant disorder, depression, sadness, anger, aggression, acting out, fears, OCD, PTSD, phobias, panic disorders, like when you kind of fall out of favor with your family or you are disillusioned with your family. Maybe there's a divorce or separation or a new child in the family or something like that, and you no longer feel like you're getting the attention you need. Abuse, all sorts of abuse, sibling rivalry, violence, bullying, just either you're the victim of or you are the perpetrator. Disruptive behavior, cheating, lying, impulsivity, stealing, traumatic events, crimes, accidents, hospitalization, and these are long-term hospitalizations, perhaps following a traumatic brain injury or a car accident or something like that. Grief and bereavement issues that become they impact the child's ability to develop on the normal growth and development continuum. Stress, overly shy, elimination disorders, attachment disorders, and on and on. Their therapeutic play is a free resource for patients and families. And whereas play therapy does cost, it's billed to insurance. It requires parental consent. You have to commit to bringing your child in every week, once a week, twice a week, whatever, for the duration of the treatment, which is generally 6 months out of the year. So there, it's a pretty heavy commitment. And it's a way for a child to assume some in a play therapy room, the therapist follows the child's lead. They don't solve the child's problems, but they promote an independence and an autonomy and an empowerment in the activity room, the playroom, where they allow the child to be in control. And then the child pretty much solves their own problems through that play therapy session. The play therapist only intervenes when the child is going to harm themselves or the child is going to harm the therapist. So it's therapy that comes from within, and it's fostered through a variety of different play therapy mediums. So the things that affect a child's play in the hospitals, the play environment, parental contact, having parents close by and welcoming them into the playroom, the age of the child, because we know that children are most vulnerable at 7 months to 4 years of age because of stranger anxiety, separation anxiety, and magical thinking in those preschool years. When a child is hospitalized for a longer period of time, it can be very difficult, and it is a variable that does affect how a child adjusts to hospitalization and the type of illness, of course, whether it's chronic, critical, or just a 1 or 2 night stay. And then gender, because boys and girls experience hospitalization differently, and they share their feelings differently. And this is all documented in your in research and in your book. So, can child life specialists do both play therapy and therapeutic play? Yes, but you have to be able to work with a child one-on-one and over a very long length of time. So, and you have to be able to have access to a play therapy room with all of the same prescribed toys that are in one play therapy room to the next. All right, so this goes on to talk about different modalities used in play therapy. And the take-home message is whether or not therapeutic play and play therapy are the same thing, and they are not. So that is what you would, how you would answer that question on the final exam. It's true or false. Are they the same thing? And you would say false. Okay, so that's what I have for you. View this lecture at your leisure, and I will see you the following week. All right.